Good evening, everyone, and thank you for joining us tonight. My name is Donna, and I'm with GENESIS Fertility. Conducting this evening's seminar is Brittany Palmieri. Brittany is an OI clinical coordinator with GENESIS, and she's going to be talking about what to expect during an IUI cycle. I'm going to ask everyone to please hold all questions until the end of the presentation. And without further delay, I'll turn the controls over to Brittany.
Thank you, Donna. Hi, everyone. My name is Brittany, like Donna mentioned. I'm one of the nurses here at GENESIS Fertility, one of the OI nurses. Some of you may already know me already. I might be new to some of you as well. So thank you for joining me tonight. We're going to go through various slides of what to expect during ovulation induction cycle. Throughout the slides I go through, if you have any questions, you can please just jot them down. I'll be happy to answer them at the end of the presentation. So we are going to start, and first I'm going to introduce our doctors here at GENESIS Fertility. So Dr. Richard Grazi, he is our medical director. He is the founder of GENESIS Fertility as well. We do have Dr. Catherine Melzer-Ross, who is the director of our IVF program. Dr. Tende Chawari, who is our donor program coordinator as well. Dr. Alexandra Kotlier, who is our director of the resident education. And we do have two nurse practitioners at GENESIS as well, who you may come across throughout your cycle at GENESIS. We have Shira Yafi and Rahana Charles. So if you might see them at your initial visit or at the end of during your OB scan as well. So some just basic information of our locations and monitoring hours. So we are the main location at the Bay Parkway. We are open 365 days a year, rain, snow, shine. Our location is always open, even on the weekends and holidays. We do have other satellite locations. We have one in Staten Island, one in Hewlett, one in Park Slope, and one in Queens. So any times when you have to come in for your monitoring for blood work and ultrasounds, you're more than welcome to go to one of those satellite locations. Each location has their own monitoring hours. So if you do go to one location, just be aware of what the monitoring hours are, and please go between those times. The Bay Parkway location is open on the weekends and holidays as well, but the satellite locations are not. So if you do have to come in for blood work and ultrasound on a weekend or holiday, it will have to be at the Bay Parkway location. These monitoring hours and locations are also updated on our website, so you can feel free to check that out if you want to as well, or if you forget, you can always check our website for those hours. Some basic contact information. So our GENESIS main number line, you can reach us Monday through Fridays from 8 o'clock a.m. to 3:30 p.m. Anytime you need to make an office visit or you need to be redirected to a different department, you can call our GENESIS main line number. We do have our direct OI nursing number. So anytime you need to talk to one of the nurses directly, you can call us between 8 a.m. to 4 p.m. Mondays through Fridays. If we don't pick up, we're not ignoring your call, I promise you. You can just leave a voicemail with your name and your number, and we'll definitely get back to you by the end of the day. After 4 o'clock, the nurses do leave. So in case of an emergency, whether you're missing medication, if you're pregnant, if you're bleeding, any type of emergency situation, we do have a nurse on call for 24 hours. So you can call our service line numbers after hours, after 4 o'clock, and on weekends. On weekends, we do not pick up on phone calls, so you can always call the service line number if needed, or wait until Monday to reach one of the nurses. All this information is on our website, which is genesisfertility.com, or you can email us at oinurses@genesisfertility.com as well If you have any questions, we'll respond by the end of the day to your questions. So what to expect at your first visit at Genesis. So at your first initial visit, you're going to meet with your physician. Your doctor is going to review your history and your medical records. You'll also probably have a physical exam and an ultrasound at that time. Your doctor may also have blood work that may be ordered after your office visit. Every test is individualized and not performed on every person. So during this time, it's the best opportunity to talk to your doctor if you have any questions, any concerns. They are there to answer any questions that you have. They will come up with a plan individualized for what is best for you. And any type of questions, concerns, please ask at that visit with your doctor. So, infertility can be due to different factors, such as female factors, male factors, and unknown factors. At your visit with the doctor, they will come up with a diagnosis that fits based on your blood work, based on your ultrasound. They will come up with the best diagnosis for you, and we are going to be here to help you throughout your process. So, what are some prerequisites for an OI cycle? So before starting your OI cycle at Genesis, there are certain prerequisites that we do require. So at your initial visit, your doctor will have you do some blood work. One blood work is called your AMH level, which is your ovarian reserve testing, which is your egg supply. Also, your day 2 FSH level, which is very important for insurance purposes. So when you get your period, you will give us a call and we will instruct you to come in on either day 2 or your day 3 of your cycle for this blood work, and your AMH level can be done at your initial visit. Your doctor is also going to have you do your fertility panels. So fertility panels on both yourself and your partner, which will have to be done within 1 year. And that's a list of infectious diseases such as HIV, hepatitis. We just want to make sure everything is negative before we begin the cycle. Genetic screening as well. Your doctor may require you to do genetic screening. If you are a carrier for a certain disease, we do want to make sure that your partner is also not a carrier for the same disease as well. Reason why? Because it can be passed off to your offspring if you are both carriers for the same genetic disorder. So it's very important to know. That way we can help you at the best way possible to not carry this off to your offspring if you are carriers for the same genetic disorder. Also, consents to be signed for your IUI and COVID-19. So 2 consents in our department that have to be signed before the IUI procedure. IUI consent, which allows us to put the sperm into your body, and COVID consent, which is general, which everyone has to sign. A semen analysis may be required by your doctor as well. At your initial visit, your doctor may recommend for your partner to do a semen analysis before we proceed with the IUI. That's to check the motility of the sperm and the Kruger. Also, your doctor may have you do a class beforehand with myself or one of the other nurses in our department, or we can send over some modules to you which give you a general information about how the cycle works. Also, we will order you your medication at that time. It's always best to have your medication at home before you begin your cycle. So that way, last minute, you're not worrying about not having it, calling it into the pharmacy. So we always love to have your medications at home before the cycle begins. Also, at your visit with the doctor, they may require you to do a sono HSG, which is also called a saline sonogram. And this is a transvaginal ultrasound where sterile saline solution is inserted into the uterus. And that's checked to check for any abnormalities, such as polyps, fibroids, or uterine scars. That may be required if your doctor at your visit requires you to do so. Also an HSG. And an HSG, if needed, your doctor will let you know, and that is a dye that's injected through the cervix into the uterus. and this will check to make sure your fallopian tubes are open. If required, your doctor will let you know at your visit if these tests need to be performed. Also, financial clearance. So before beginning your cycle, we want to make sure you're financially cleared. So they may ask you to speak with our billing department beforehand. So some basic information about understanding your menstrual cycle. So like a book, we have a beginning, middle, and end. So just like our menstrual cycle, first we have the follicular phase, and this is the pre-ovulatory portion of the woman's cycle. This is when the follicle begins to grow and your estrogen level starts to increase. The ovulation phase is when your ovary releases a mature egg, and this egg travels down to your fallopian tube towards the uterus to be fertilized by the sperm. This phase is the only time when you can become pregnant. About 32 to 40 hours after the onset of your LH surge, ovulation occurs. The luteal phase is the post-ovulatory phase of the woman's cycle. The corpus luteum produces progesterone, which causes the uterine lining to thicken in order to support implantation and a growth of an embryo. So this is just a little diagram. So we have the menstrual phase, which is the ovary is upset, it's crying, it's shedding its lining. Then it's going to get a little happier. It's traveling to the follicular phase where the egg is starting to develop and to grow. And then it becomes super happy during the time of ovulation. Your ovary is getting ready to release that mature egg. And the luteal phase is when the egg is released and then hopefully fertilized with the sperm. So how to start the OI journey. So how do we start the OI journey? So first, most important thing, if you don't remember anything at all, is to call the nursing line number on day 1 of your period. So on day 1 of your period, it's very important to call the nursing line number. And you're going to inform us that today is day 1. Myself or one of the other nurses you speak to are going to have you come in on day 2 or day 3 for your baseline testing, which consists of your lab work and your ultrasound. So what is your baseline? So before you begin any medication, we bring you in for your baseline testing, which consists of various hormonal levels, such as your estrogen level, your beta level, your progesterone level, your LH level, and your FSH levels. These levels are your hormonal baseline, and this will let us know if you're ready to begin on medication. We want to confirm you're not pregnant. We want to make sure everything is quiet and okay to begin. Your ultrasound you'll have done as well, and that's to check your uterine lining and your ovaries. We want to make sure everything is clear, no residual follicles left over, no cysts before starting on the medications. Anytime you come in for your blood work and ultrasound, you'll always get a call back the same day before 4 o'clock with the decision of what to do next. So once we get your results back, we will go over your results with the doctor. The doctor will give us your decision, and we will be giving you a call back to let you know how to proceed. So medications. So at your initial visit, your doctor is going to inform you a protocol, what's best for you. So there's 2 medications, oral medications called Clomid and Letrozole, and there are also some injectable medications called Metapure, Gonal F, or Follistim. So your doctor will let you know which medication will be best for you, either oral medication or injectable medication. These medications will help stimulate the resting follicles within your ovaries to grow and develop. Based on your diagnosis, based on your age, based on all your blood work, your doctor will let you know what's the best protocol for you. If your doctor puts you on oral medication, or whether it's Clomid or Letrozole, generally it's started on day 5 of your cycle. On day 5 of your cycle, and it's taken for 5 days. If you have shorter cycles, your doctor may have you start a little earlier on day 3, depending on your cycle length. The medications are usually taken in the evening at the same time every day. And once you don't finish the medication, after 5 days, we're going to have you come back in and we're going to see how you're responding to the medication. If your doctor decides to put you on injectable medication, which are usually subcutaneous, which means either injected into the stomach or into the thigh area, personal preference or whatever you feel comfortable doing. It's usually started on day 3 of your cycle and taken for 3 days. After you finish the medication, you will come back in and then we're going to see how your body responds to it. If you're not ready at that time, your doctor may have you continue the injectable medication for more nights or may increase or decrease your medication dosage as well. Again, once you finish, you'll return to the office and we will give you further instructions from there. When you come back into the office, what are we looking for? So you just finished the medication. We're hoping now the medication is stimulating your ovaries to create these follicles. And we're looking for follicular growth. So we're looking for at least one mature dominant follicle around a 20 millimeter. What is a follicle? So what a follicle is, it's a fluid-like sac that contains your eggs. So basically, when you come in after finishing the medication, we are going to check your blood work and your ultrasound as well to see how many follicles you have, what size they are. And then we're also going to look at your hormonal levels to see how close you are to ovulating and other blood work as well. We're going to check your uterine lining. And also remember that the time frame is dependent on your body's response to the medication. So it might be someone you may know may respond very quicker and someone otherwise may respond very later on in the cycle. So it all depends on how your body responds to the medication. When you come in and we see that you do have a nice sized follicle, we're going to let you know what your next steps are. If you come in and your body's not ready yet, you may come in and the follicle size may be small yet. It may be an 8, it may be a 10 millimeter follicle. So your body still needs time for the egg to mature. So the doctor may say, bring her back in 2 days, bring her back in 3 days. We're going to continue to monitor you until the egg size is ready. If you are on the oral medication, you won't have to take more medication. We're just going to monitor you gradually until that egg is nice and mature. When you're on the injectable medication, if the follicle is still small yet, the doctor may have you continue on the same dosage or increase or decrease the medication at that time. Once you are ready and you do have a nice mature follicle and everything looks great, we are going to let you know when to take an ovidral injection, which is also called a trigger injection, and then to plan the insemination, the IUI procedure. So what is ovidral and how to self-inject? So you come in, you have this big, nice, beautiful follicle that's around the 20 millimeter, which is where we want it to be. The doctor is going to say, okay, everything looks great. You are ready to take your ovidral injection. Ovidral is a hormone that causes the body's release of the mature egg from the follicle to ensure the ideal timing for the insemination. So what the ovidral is doing, it's basically mimicking what we naturally do each month. Each month we normally ovulate, but when you're on the medication and you come in for the blood work and ultrasound, you may have this nice mature egg follicle, but your body's not ready to release it yet. So what the ovidral is going to do is going to cause your body to release the egg from the follicle, and then we're going to time the insemination from then. The ovidral injection itself is a pre-filled syringe. So it's a subcutaneous injection, a one-time injection shot. You will keep it in your refrigerator until the time to use it. So once you get it at home, keep it in your refrigerator, not freezer, until we let you know when. Sometimes prior authorizations is needed, so that's why we like to order you the medications ahead of time, because if it is needed, we'll take care of it beforehand and not last minute, so that way you won't be worrying last minute that you don't have it at home. We do have on Freedom Med Teach a guideline and a video that shows how to do the Ovulation injection at home. Um, if you have any questions or concerns, you can always call the nursing line number. You can always walk in, and we can always show you in the morning how to do the injection if you're afraid to do it on your own. But I promise you, it's not painful and it should not hurt. If you don't want to do it on your own, you can show someone else, your partner or someone else, to do the injection for you. You can show them the video as well. And I promise you cannot mess it up. So how is an IUI done? So you're on this medication, you come in, you have this nice, beautiful, mature follicle. Everything looks great. We're going to instruct you to take the Ovulation injection shot to release that egg from the follicle, and now we're going to time out the IUI procedure. So, an intrauterine insemination, it's a procedure where the washed sperm are placed into the uterine cavity with a small catheter. An IUI bypasses the cervix and places the sperm closer to your fallopian tubes around the time of ovulation, that the sperm can be easily met with the egg. An IUI is recommended where there is a problem such as low sperm count or motility, also in case of an unexplained infertility, a lack of ovulation, or issues with cervical mucus. So with the insemination procedure itself is we're taking the sperm and we're putting it directly into the uterus for you with a thin, tiny catheter. More about the intrauterine insemination. So the procedure can be performed with either a partner sperm or with sperm from a donor. Your partner will be asked to provide a semen sample about an hour before the insemination. He can produce at home if he does want to, if he's more comfortable, which you can get a sterile container from us. And within the hour of production, you can bring in the sample to the office. Or we do have a production room at Genesis where your partner can produce as well. If your partner cannot make it the day of the IUI, we do have an option to freeze the sample ahead of time. If your partner travels for business or a truck driver or whatever job he has that he's not able to be the day of the IUI at Genesis to produce the sample, you do have the option to freeze ahead of time. If you're using donor sperm, the lab will thaw out the vial beforehand. So once you arrive at Genesis, once you sign all the paperwork, that's when they will start to thaw out the donor sample. The sperm washing usually takes around 1 to 2 hours. So it really depends on how busy the lab is. So after he does finish producing, you can definitely wait in the waiting room, or you can go out, you can go get something to eat and come back within the hour. But usually it ranges from 1 to 2 hours until the sperm sample is ready. The insemination itself is really short. It only takes a few minutes and it's done by the nurses. So all our nurses are trained to do the IUI insemination procedures. It only takes a few minutes. So once you come in, you produce the sample. Once it's ready, we'll call you into the room, and the insemination itself is fairly short. You most likely won't feel any discomfort, but you may have a little mild cramping and spotting afterwards. I promise you it should not be painful. That's one of the questions I get a lot. Is it painful? I promise you it should not be painful. And this is just a little diagram of how the IUI insemination procedure, what we do. So we take a thin, tiny catheter, we attach it to the syringe, which we draw up the sperm, and we insert a speculum. And when we insert the speculum, what we're looking for is we're looking for the cervix. So the cervix, it has a little opening that connects into the uterus, and we're putting the catheter through that cervical area into the uterus, and we're injecting the sperm in there, and hopefully they swim, swim, swim and meet the egg, and hopefully fertilization takes place. So after the IUI procedure, what are some things you should be doing? So you should be taking your prenatal vitamins throughout the whole cycle. If not, then we do recommend after the IUI that you do begin your prenatals. You are allowed to go to work afterwards. You do not need to be bed rested at home. You can definitely go into work. We do advise no heavy weightlifting or abdominal workouts the day of the procedure, and you are allowed to have intercourse that night. If you have any cramping after the procedure, you are allowed to take Tylenol if needed, or a gas axe if you're feeling bloated. But other than that, no Advil, no Motrin, no ibuprofen, just the Tylenol and the gas axe. So 2 weeks after the IUI procedure, you'll come back into the office for blood work. And the blood work we're testing for is your pregnancy hormones. So we're hoping in 2 weeks later that you do become pregnant from the IUI procedure. If you do get a positive pregnancy test, then we are going to have you come back in 2 more times to repeat the blood work to make sure that the levels are continuing to rise up nicely. If everything looks good, then we are going to schedule you a 6-week scan with the doctor or the nurse practitioner. Some potential complications and outcomes. So one of the complications that can happen is something that we call a cancel cycle. So a cancel cycle can be due to 2 reasons: a lack of response or an over response. So after taking the medications, you may come in and we don't see any follicular development on the ultrasound. The doctor will say, maybe let's give her a couple more days. You come back in and still nothing. At that time, the doctor may say, let's increase your medication for 5 more nights and see what happens. So you might be something called stair step, which means we will increase your medication at a higher dosage for 5 more nights to see if you will respond. If no response, again, then the doctor may say, let's cancel this cycle, and whether you'll meet with the doctor will come up with a different protocol for you to do something differently next time. Another complication is over-responding, which is rarely seen, but sometimes it does happen where you'll take the medication and you'll come in and we might see an abundance of follicles, which is dangerous because we don't want risk of multiples. So, the doctor may say we may have to cancel the cycle and start again next cycle, maybe at a lower dosage. A next complication that can be seen is an unsuccessful IUI procedure. So unfortunately, we wish and we pray that in 2 weeks we can give you some good news, but sometimes the IUI is not successful. So I tell all my patients, please don't be discouraged or upset if the first IUI cycle does not work. The doctors do want you to try at least 2 to 3 cycles before revisiting with them. So with your next menstrual period, you will come back in and we will begin the cycle again, whether it's continuing on the same dosage of the medication or at a higher dosage. And the doctor will determine that for you. If unsuccessful after 3 IUIs, then the doctor will want you to revisit with them to go over all 3 cycles with you and to discuss next steps on how we can proceed. So those are some basic complications that can happen with an IUI cycle. So what are the goals of the OI nurses and staff here at Genesis? So our goal is to make your journey at Genesis as smooth as possible. We are here to answer any questions and concerns you may have and educate and teach you about your cycle, treatment, and outcomes, providing support and guidance throughout. So anytime you have any questions for the nurses, any concerns, anything at all, feel free to give us a call. We're here to help you out and to make your journey as smooth and as possible